In 2007, the number one class of medications prescribed were antidepressant and anti-anxiety medications. Things like anxiety, depression, fatigue, and insomnia can be thought to be problems related to neurotransmitters in the brain. Neurotransmitters are tiny chemicals that are secreted by one brain cell and travel to another brain cell. Neurotransmitters carry certain messages with them, such as go to sleep, make energy, and they help us to have an overall feeling of well-being. Neurotransmitters communicate within the brain thousands of times each second. It took scientists a whole room full of supercomputers to do what one simple brain cell could do. Many neurotransmitters are made from proteins, such as eggs, beef, and fish. Your body breaks the protein down into tiny pieces called amino acids. Each amino acid has its own shape and size. Your body then takes some amino acids and links them together with other amino acids to make neurotransmitters. For example, your body may take amino acids A, B, and C and link them together to make the feel-good neurotransmitter serotonin. You need to be able to break protein down to make neurotransmitters. Sometimes due to genetic weaknesses, intestinal problems, or other problems with the body, a person cannot fully or properly break protein down into amino acids. If you can't make amino acids, you're going to have a difficult time making the correct level of neurotransmitters in the brain. So some of the symptoms of low neurotransmitter levels due to poor protein digestion are depression, feeling irritable, feeling anxious or having anxiety attacks, feeling fatigued. Also, many of the neurotransmitters are necessary to help the body relax so it can get into a good, deep sleep. When these neurotransmitters cannot be produced, it can cause insomnia. People with low neurotransmitters due to poor protein digestion can have intestinal problems, such as bloating, constipation, heartburn, diarrhea, reflux, and indigestion. They can also have a loss of muscle tissue in the legs because the body will try to break its own muscles down to make protein. And they might have a general feeling of weakness. There is no medical way to check the levels of neurotransmitters in the brain. However, remember neurotransmitters are made from amino acids, so you can check the level of amino acids by doing a standard blood draw, as you would do in any medical clinic, or out of the comfort of the patient's home, they can do a simple finger prick. The lab work will show us the exact amino acids that are out of balance. We then use a compounding pharmacy to make our patients a customized amino acid formula specifically for them. Look on the screen, you'll see it says Robert DeBease. That's my own formula for me. We at Alternacare know there are a few patients who would like to improve more quickly, and the amino acid lab might be the correct next step. For those patients, I wanted to make it easier for them to get the amino acid study. Normally, the cost of the amino acid profile is $499. However, throughout the month of May, for our existing patients, it's only $295. This is a savings of $205. So talk to Dr. Poley, Dr. Rob, or any other Alternacare staff member if you have questions about the amino acid lab. As if you're not responding fast enough, this might be the lab that's necessary for you to do.